When we're looking at the effectiveness of mitigation strategies in a room that come to looking after the air, so the MERV, the minimum efficiency values of those filters, an 8 grabs dust, it grabs pollen, it grabs larger particles. It will not take out respiratory droplets and it will not take out a virus. The very first level filter that does that is a 13. And they go up to 21. 21 is the highest level you can get. There is no real commercial system in any school that would be running 21s, and nor do you need to. So the schools that can get to 13 should try to get to 13, but the univentilators won't allow that to happen. So univents get to an 8, and that's as much as you can get. About 15-20% of schools, if they've got a central air system, can get to 13s, but most of them can't. Because you can't push the air through those filters if you're dealing with an old air handling unit. So in those circumstances, what we're not left with, what we need to do and what we need to look at in those cases is what can we do to increase the ventilation of those systems. So with some of the univents, you've got the option of, with the economizer, how much outside air they bring in. So in certain times we can turn it down to 10% outside air and 90% air inside the classroom. And that's using the filter that you've got installed to recirculate 90% of the air. What we want to do is open that right up and make it 100% outside air coming in. And if that's the case, you don't need to worry about what the filter is, because the filter's not doing anything because we're bringing in 100% outside air. So the goal of all our HVAC systems, our univentilator systems, is if we can't get them to the MERV rating, we make them as wide open as possible with the outside air that we bring in. And that is, outside air is better than filtration. I mean, it's not a substitute, it's better than it. Now, if we can get Merv-13s and outside air, that's an extra layer, but that gets hard to manage sometime and maintain constant temperature and humidity in classrooms. We want to be getting at 4 air changes per hour at an absolute minimum in a classroom. So it can be 4 air changes per hour through a Merv-13 filter. It can be 4 air changes per hour through a HEPA filter, or it can be 4 air changes per hour with outside air that can come through your univent, that comes through your HVAC system, or a box fan on the window. That's the minimum we want to be at. The goal that we try to get to is 6. If we can get to 6, we know we're right in that safe level of where we need to be. HEPA filters, they will filter out naked virus out of the air. So whereas a Merv-13 grabs virus that is encapsulated in spit and takes them out, a HEPA filter will grab naked virus out of the air. And there's not naked virus in the air, so don't worry about that, but they can go down that small. So any air that they're discharging into the space is clean. Now, if you're relying on those, that's perfectly fine, but then don't use the carbon dioxide technique in that classroom, because you don't have ventilation in that space and you will see it go up and people will freak out. So when you've got HEPA filters there, HEPA filters are turning over the air, so just have them balanced to do a minimum of 4, preferably 6 or more turnovers per hour, and you're looking great. Make sure if people are going into the space of HEPA filters, there is some, I'll call them parasites in the world, that are coming into these now to sell things that are not great. What you're looking for is something called a CADA, so it's clean air delivery rates. So a CADA for smoke, because they give clean air delivery rates for pollen. A virus is much smaller than that.
Okay. Yeah.
So look for a CADA for smoke to get in, and then don't get any bells and whistles on it. Like ionization systems don't work. UV systems do, but they do create an ozone risk to your classroom if they're not properly made. So we don't need more bells and whistles on them. Go for ones that give a clean air delivery rate for smoke. When you see the smoke one, you know that they've passed the tests that we need to make sure that they're not just a knockoff coming from somewhere else.